Good morning, everyone. My name is LV Sevilla, and I am a student of Walden University under the instruction of Dr. Doris Hill and my preceptor, Deputy Chief of Education Services here in VA Medical Center, Fresno, Jennifer Klein Smith. When a nurse diligently follows prescribed protocols for donning and doffing PPE before and after caring for a patient with a highly contagious respiratory illness, meticulous adherence significantly mitigates the risk of exposure. In contrast, when another nurse overlooks proper PPE procedures, accidental contamination occurs, potentially spreading the disease to other areas or the healthcare workers. Following precise protocols for PPE usage is a fundamental duty for creating a safe and healthy healthcare system. This pre training module that sets the stage for subsequent immersive experiences will be followed by simulation based training, where participants will engage in simulated scenarios that will allow for hands on application of PPE protocols. Post simulation, there will be self assessment through an open discussion. This will culminate these elements in improving practical proficiency and conceptual clarity. The Lairdale High Fidelity Simulation Mannequin closely resembles a human in size, weight, and anatomical features, simulates realistic vital signs, and mimics physiological responses to medical interventions, allowing learners to observe and respond to changes in the dummy's condition. The mannequin also incorporates interactive elements like audible heart and lung sounds, palpable pulses, and reactive pupils, adding to the immersive learning experience. Contact precautions are intended to prevent transmission of infectious agents, including essential microorganisms, which are spread by direct or indirect contact with the patient or the patient's environment. CDC recommends contact precautions when MRSA holds clinical significance, advising single patient rooms for those needing such precautions across various healthcare settings. The protocol entails hand washing and donning PPE before entering patients' rooms, with a specific sequence for doffing to prevent microorganism transfer. Donning PPE involves fully covering the torso and arms with a gown fastened securely in the back and wearing gloves extending over the gown's wrists. Doffing occurs at the doorway, followed by immediate hand hygiene. Lastly, leaving the door closed is crucial to maintain infection control measures upon exiting the room. Please visit VA Central California Healthcare System Standard Transmission Based Precautions Protocol, dated November 20, 2015, effective date July 1st, 2021, recertification date July 31st, 2026. Let's check your knowledge. What does PPE stands for? Which of the following is not considered a component of PPE? The correct answer is C. What is the primary purpose of PPE? The correct answer is C. The primary purpose of PPE is protection. What is the correct order for donning PPE? The correct answer is D. The correct sequence for donning PPE is gown, gloves, mask, and goggles, following the order that minimizes potential exposure to hazards. True or false? PPE can be reused if it appears clean after use. The correct answer is false. PPE should not be reused unless designed for multiple uses and properly decontaminated according to guidelines. Visual cleanliness does not guarantee absence of contamination. Which of the following should be considered for safe disposal of used PPE? The correct answer is B. Following institutional or local guidelines for disposal ensures proper handling and disposal methods, preventing potential risks associated with contaminated PPE. Now you are ready to practice the skills.